Hello, everybody, and welcome to Five Questions with Sarah Downey. I'm Sarah Downey, and I'm the President and CEO of the Michael Garron Hospital. And it's my great pleasure today to have Mitzi Marino, who is the President of the Michael Garron Hospital Foundation, with us for Five Questions. Welcome, Mitzi.
Thank you very much for having me here today.
So let me start with a basic question, which is, can you tell me a bit about what the Michael Garron Hospital Foundation is?
Sure. Maybe I'll just start from a practical standpoint. We are a separate entity from the hospital with our own board of directors. The reason that the Michael Garron Hospital Foundation exists is solely to support the Michael Garron Hospital and as part of our broader network, the Toronto East Health Network. Our vision, I'm proud to say, and I think it was something that we deliberately did a few years ago when the hospital came up with its own vision. Our vision is one and the same as the hospital, so it's to create health and build community. So that is the what. The how we do that is different from how the hospital does it. Our mission is to raise funds and engage our community in support of the hospital. So that's just how we go about doing our business. We've got, just to provide you with a little bit of context about the foundation, we've got 16 staff, and we are responsible for different parts of the business. So we've got exceptional staff, talented staff who fundraise to build relationships with donors, to facilitate meaningful opportunities to give back. We've got special event professionals who carry on our signature events. We've got marketing and communications people, administrative staff who perform work like gift processing. So that's sort of our team. We're a relatively small team, but small but mighty, I like to say.
Absolutely mighty. I know that. So what does a gift to the hospital mean? And can you describe the impact of donor dollars to our hospital?
Mm-hmm. So a gift to Michael Garron Hospital really is a gift to our entire East Toronto community. Our donors are ensuring that our frontline healthcare professionals have the equipment, have the facilities, the space, that they need to provide exceptional care. They fund research, they fund education. We're currently in the midst of a $100 million Heart of the East campaign in support of the hospital's huge redevelopment. And so with that, we are not only raising funds for our redevelopment, but for other emerging priorities as well.
Great. So it sounds like without you, Mitzi, we couldn't do some of the special things that this hospital does.
Well, I think, when I think about some of the funding that we have done over the last little bit, the equipment purchases, the renovations that we've been part of, I like to think that for sure that our donors have enabled a lot of that. And so it's nice for us to be able to show them the impact of their giving. So I think that we've got a tremendous philanthropic zest in our community, and people do want to give back. They want to contribute.
Right. And I, like you, have never felt it more than I have over the last several weeks during COVID-19. So can you describe some of the community initiatives that the foundation has launched during COVID-19?
Yeah, for sure. I mean, it just all these last few weeks have seemed a bit of a blur. When I think back to, I guess, almost 11 weeks now, 10, 11 weeks, when we started with our PPE drive, really at Dr. Michael Warner's, he, over the weekend, I think he and a few friends created a bit of a website, and we were off to the races. So we helped with a PPE drive along with many others, and have to date collected close to 1,000 pieces of PPE, gloves, masks, gowns. We've also we've also received a lot of, other items. So like hand sanitizer, sorry, goggles and whatnot. And it's just been really overwhelming to see the response that we've received from the community around that. We subsequently launched at Dr. Jeff Powis's vision, I guess, around having the East Toronto community masked. We launched our 1,000 mask initiative, and it was unbelievable to see. I think the challenge that we initially put out was to have to collect 1,000 masks within 1 week, and we were able to collect thousands and thousands more within those first few weeks. It was unbelievable. And to date, I think we've all lost count, but I think we're well over 60,000 masks that we've been able to collect, that our community has lovingly sewn for our patients, for our staff, and for the community. Because what we've been doing with those masks is we in turn have not only been masking our staff and patients and visitors who were coming into the hospital over these last number of weeks, but we've in turn been sharing those masks with our community and beyond. We also launched an emergency response fund, so there was a real interest from people to give back financially as well, and so I'm pleased to share that we've generated approximately $750,000 from that, and some of our early investments include supporting our staff along with the hospital with a transportation stipend, so we've done that, and then we've also supported some meal purchases for our staff. Which, if I go on to sort of the next item that we've really sort of been focusing on, that the foundation team has really been focusing on, is our meal initiative. And so I would say we sort of launched a pretty comprehensive meal distribution program. We are kind of wrapping up by Friday, though I've been asked for extensions into next week because I think there's still interest in providing meals. It's just been absolutely astounding to see how the community, how our restaurants in the community, how donors have really wanted to, again, give back. And this is their way of doing it, by providing meals to our frontline healthcare providers and alleviating some of their stress. Rather than having to go home and make a meal for themselves or for themselves and their families, we've been able to provide meals for them as they leave at the end of their shift, and then even throughout the day for lunches. So by the end of this week, we're looking at having distributed 18,000 meals. So we're really proud of that. And this was really at our chair, Eric Tripp's suggestion and recommendation that we do this. He felt very strongly about this, and then the board just really got behind that. So really pleased that we've been able to do that. We also have launched a new event, but before I get to that one, I'll speak of another event. We did a Conquer COVID. So Conquer COVID was our counselor, Brad Bradford's ingenious idea to get people active and cycling. It was a 24-hour virtual cycling event, and we had over 400 people participating. We had some staff participating in this event, and we were able to generate from that event over $220,000. Again, people who just got behind the hospital from, again, not only the community, but just beyond. It was incredible. We had, people from Italy and Brazil and Hamilton, a little bit closer to us, and Hamilton riding for Michael Garron Hospital. It was just wonderful to see. And Brad, kudos to him and all that he has done for us. We were thrilled with that. And then more recently, just last week, I guess it was, we launched an Instagram event around, so it's called 5 for the East. And what it is you can run, walk, scooter, whatever you like, anything that's active, but you've got to do 5 kilometers of whatever it is. And then once you do that, you can make a contribution to the hospital and then nominate 5 other people to do the same. And so we just launched that last week. It was a soft launch, and I think it's just getting off the ground right now. It was really successful out in the UK, and so we thought we'd give it a try. And so I think for me, when I think of all of those initiatives, what strikes me is that behind every donated mask, every pump of hand sanitizer, engagement in an event, every ear saver that people have made, people came together and started using their 3D printers to print goggles and masks and ear savers, is to me representative of a community member who has wanted to give back and to support our team. So for me, it's just been an overwhelming experience.
It has, and I thank you for working so hard and so diligently on all that. You and your colleagues have spent, well, the weather's nice now. A couple of weeks ago, it certainly wasn't.
Oh my gosh, yeah, we've been fortunate. Yeah, we were out in our parkas and woolly hats just up until about a week ago or so. So
giving out 18,000 meals has been incredible, as well as some of the other many special treats that have been able to come to staff. And I think it's been, as many of us have been focused internally on just trying to be ready and prepared and safe for COVID, it's been wonderful to find through our foundation links to our community, so they too can help us, and you've been a great conduit to that. But I suspect COVID-19 has shifted the business and operating model for the foundation. Can you describe what the impact of it is and what's next?
Yeah. Sure. So, I mean, we're no different than the next team, just as everybody else has pivoted, so have we, right? And it was really our pleasure and an honor, really, to be able to pivot and to be able to support our healthcare providers here at the hospital. And that has really been our focus over the last number of weeks, is really on supporting our colleagues. In terms of going forward, we're really keeping our eye on the ball and really focusing on our redevelopment and on our campaign. I mentioned that it is a $100 million campaign. We're currently at 92.5, so we're sort of inching our way up there, but that is our primary focus, and we really just need to be able to deliver to the hospital what we promised. So in that, we're going to need everybody's support. We've been really it's been heartwarming to see how everybody has really got behind, how the community has really got behind the hospital. And so I'm just encouraging everybody to continue to do the same, get involved, do what you can. We really appreciate everybody's support and all the attention that we've been getting. It's been heartwarming and wonderful to be a part of. So, and I'd have to say, I mean, I'd be remiss if I didn't say that all of this takes a team. So it not only takes, for sure, my team here in the foundation, but it takes a team beyond ours. We're a small team, as I mentioned. So without the tremendous collegiality and partnerships that we have and have been able to forge, we wouldn't be able to do our jobs as well as we do. So, when I think of particularly the meal distribution, that has taken a little village to pull that together. So, it's just, again, just been wonderful. And I would just do one tiny shout out to, there's so many people to thank, but I wouldn't want to miss anybody if I start listing everybody, but for sure I'd like to just do a special shout out to Denny and to Angela, who have been unbelievable to work with, and just tremendous partners throughout all of this.
Great, I agree.
Mm-hmm.
And thanks, Mitzi, to all of your team as well, who've kept us fed. I've heard so many lovely comments from my colleagues in the hospital about how good they feel when it's their day to get a meal and to take it home to their family. Some of the freebies have really lifted their spirits through this really hard time. And I guess my wish is, so much has changed for the foundation, the soccer event, the golf event, the galas. We don't know when we can congregate again and types of settings. And I know how resilient you and your team are and creative are in continuing to promote the great work that happens in Michael Garron and to get some extra financial support for us. I have a great confidence in you and your team to continue to put our best foot forward and help us out. And so thanks for everything. That's the end of 5 questions with Sarah Downey, and thanks everybody. I hope you enjoyed it.